Hey YouTubers, I'm about to exercise and I wanted to address a message or a comment I got on YouTube about, do you have an exercise program for women? And I'm going to try to answer it this way. Everybody's a little different with their strengths and their deficiencies. In my opinion, I think that everybody needs an exercise prescription. And I formulate the prescriptions for the individuals based on their deficiencies, right? Because I don't want to have an injury occur. So I'll work on a couple things. In order, it'll be flexibility, number 1, proprioception, number 2, explosive power, number 3, strength, endurance, and cardiovascular fitness. That's what I think the bullet points are as far as how I give patients the ideas on getting started. You always have to get somebody to watch over you, and if you can't afford the investment in physical therapy or a personal trainer, then you have to kind of do this on your own, but just go in that stepwise approach, because I think that's the best way to avoid an injury. There is no specific exercise for women, but in general I think the deficiencies for an average female are usually with upper body strength. What I would do would be to concentrate on maintaining flexibility as is, lower extremity, leg, quad, pelvis strength, and then add some kind of exercise routine to maximize on torso. That would be shoulders, back, neck, arms, chest. So if you can kind of design an exercise routine that way, not forgetting those other bullet points I mentioned, that might be a great start. There's a lot of videos on YouTube as far as how to get into an exercise routine. Try to pick and choose where your strengths are and where your deficiencies are, and hopefully you'll be able to get a well-rounded program for you. The other thing that I think is very important is to maintain sleep. I'll have a link to the previous video I did on sleep and exercise. Maintain nutrition and expect the usual, which is delayed onset muscle soreness after the initiation of exercise. If you're not sure about what's going to happen and you just hit the wall with pain, it'll be very discouraging. So you should anticipate that and work around it. I would try to avoid the more advanced techniques of exercise if you're just starting out, because the likelihood of injury is going to be higher. So get into a groove, start with those bullet points I mentioned, know when to progress, when to hold back, and when to recuperate. Try to invest in somebody who either will train you or ask a friend or a neighbor if they've exercised what they would do in your specific case.